Hello, this is Dr. Moyer, and this is the topic of HIV and AIDS. On the D2L site, under handouts in the content area, you will find several documents that detail the different types of STIs, or sexually transmitted infections. I won't ask specific details about those on the exam, but there will be questions about HIV AIDS. So this is the PowerPoint that you want to pay attention to. However, the information or fact sheets are for your information. So we will discuss, first of all, what HIV and AIDS is, brief history of HIV and AIDS, the current status, the modes of transmission, the facts and the myths, how HIV and AIDS is a unique issue for women and African American individuals. Then we'll talk about the Downlow, and we'll finish up with testing, where you get tested, etc. So what is HIV and AIDS? HIV stands for Human Immunodeficiency Virus, and AIDS stands for Acquired Immunodeficiency Syndrome. So people oftentimes confuse the two terms and say that somebody has AIDS when really they're HIV positive. And that just means that they have the virus present in their body, their system, and they can have it present for years without ever exhibiting AIDS. AIDS, the acronym is because A, it's acquired, it's not inherited. I stands for immuno because it affects the immune system. D stands for deficiency because the body lacks immunity due to the virus. And then S stands for syndrome because the symptoms occur as a group. And people don't actually die of AIDS, but they die of complications due to AIDS, meaning some other type of sickness that was able to take over their body because they acquired AIDS. So let's just backtrack a little bit. I don't know all of your ages, but if you're in your 40s like me, then when you were coming of age and learning about the opposite sex or the same sex or just sex altogether, HIV and AIDS was on the scene. So in the early 1980s, doctors in San Francisco, New York, and LA started noticing these rare diseases among young and relatively healthy young men. They had never seen these symptoms before. They noticed also that the men that were affected appeared to be homosexual or admitted that they were homosexual. So doctors thought that this was a gay disease and that it was viral. And then soon, researchers in France and the United States isolated the virus and named it the Human Immunodeficiency Virus, or HIV, which causes acquired immune deficiency syndrome. It used to be kind of labeled, when I first heard about it, it was called the gay cancer, but it actually really has nothing to do with sexual orientation. It's all about how it is transmitted. Important to note that HIV is not AIDS. To receive an AIDS diagnosis, one must have a positive blood test indicating the presence of HIV antibodies and a T cell count below 200. That's how they determine when somebody has actually developed AIDS. A healthy person has about 1,000 T cells. And in the beginning, although it appeared that only gay men, Haitians, and even hemophiliacs were the only at-risk groups, it soon became apparent that the virus was spread through sexual contact and blood and wasn't limited to those three populations. Although the disease wasn't officially identified until 1983, HIV may have been present in humans for much longer because there is the presence of HIV in old blood samples kept by doctors of patients that had died of mysterious causes. In 1902, there were reports of illnesses with symptoms that were identical to those of AIDS. HIV was identified in the stored tissue of a British sailor who died in Manchester in 1959. HIV was present in the frozen blood of a 15-year-old boy who died of what we would now call AIDS in St. Louis, Missouri in 1969. And based on the symptoms, the first AIDS cases were thought to have occurred in New York in 1952 and in 1959. In 1990, backtrack a little bit. 1987, AZT was developed. This was the first AIDS drug that was approved for HIV and AIDS and actually made a difference. Other drugs have been tried but didn't seem to help. In 1990, the Americans with Disabilities Act added HIV and AIDS to the policy, so it was illegal to discriminate against anybody living with HIV and AIDS. 1995, the FDA approved protease inhibitors, which have been very effective at controlling HIV. And in 2003, it was discovered that the origins of HIV were likely linked to SIV, a very similar type of virus, in monkeys and chimps. And no, it wasn't from having intercourse with monkeys and chimps, which is a common myth, but it's believed that hunters exposed to the blood in the monkeys and chimps that they were hunting or eating is what got it started in humans. One of the most important facts to remember about this is about 1/3 of people with HIV in the United States don't even know they have it. To me, that's a very scary fact. You can't tell who has HIV, and once unprotected intercourse has been engaged in, you can't take it back. And so I would urge parents to talk to their children about HIV when they start talking to them about how to protect themselves from becoming pregnant or from causing a pregnancy. Talk about safe sex as well, because this is pretty serious. And although there are medications for HIV now that people can take and live a very long time, they're not cured, and they do eventually die of something associated with HIV, even if it's side effects from the medications. Okay, the current status of HIV and AIDS worldwide. So the latest statistics that I can get from the National Institute of Health are for 2010. And it now is considered, HIV/AIDS is considered a pandemic worldwide. At the end of 2010, more than 34 million people were infected with HIV or had AIDS. Half of those people were women. There are several factors that contribute to AIDS or HIV being a rampant epidemic in southern Africa, which is seriously affected by HIV. It's home to more than 60% of the world's infected adults. So the majority of infected adults do live in southern Africa. So why is this? Several reasons. Poverty, lack of knowledge about how HIV is transmitted, prenatal transmission from mother to child, fear of discrimination interferes with getting tested, high mobility linked to migratory labor systems, high levels of other sexually transmitted infections, the low status of women, they can't speak up and they can't demand a condom, sexual violence, and then ineffective leadership during critical periods during the spread of HIV. The prominent or dominant mode of transmission of HIV in sub-Saharan Africa is heterosexual transmission. Which brings me to myths about how you can actually contract HIV. Please, please educate yourself. You cannot get HIV from casual contact, from contact sports, from inanimate objects, from blood donation, from insect bites, saliva, tears or sweat, vaccines, or water. The CDC has no documented cases of HIV being acquired through any of these means. And HIV cannot live outside the body fluids, where it's normally found, so it can't survive on countertops, toilet seats, drinking fountains, telephones, eating utensils, doorknobs, etc. You can disinfect surfaces or objects with bleach or alcohol if blood or semen gets on it, and you will be protected. As far as giving blood donation, only sterilized needles are used, and then they're thrown away. The virus has been demonstrated in labs not to replicate in flies, ticks, or mosquitoes. And there's only a small amount or small fraction of people that have HIV detectable in their saliva. However, the enzymes in saliva are hostile to the virus. And so there's very few, if any, in somebody's saliva and not enough to transmit it. Theoretically, if somebody had an open sore in their mouth, it might be possible, but there haven't been any documented cases of this type of transmission. And tears or sweat, HIV is in minute quantities in tears, but again, no cases of transmission, and researchers have not been able to find the virus evident in sweat. With vaccines, fresh needles are used. So there's a lot of fear and misconceptions regarding HIV and AIDS transmission, but the CDC tracks cases, and there just isn't any scientific evidence to suggest that you can get HIV or AIDS through these ways. No matter what you've heard from anyone, trust the science and the research. So how can you get it? Well, there are 3 main modes. Through vaginal or semen fluids, through blood, and through breast milk. So those are the 3 modes. You can contract HIV from vaginal or anal intercourse without a condom. You can contract it from fellatio without a condom, or cunnilingus without a condom, and that is oral sex. Fellatio is oral sex on a male, and cunnilingus is oral sex on a female. It can be transmitted from mother to fetus in the uterus or in the blood during delivery. It can be transmitted through breastfeeding if the mother is HIV positive. It can be transmitted by sharing contaminated needles with HIV-infected blood. Also sharing of sex toys because of sexual fluids, so without disinfecting them, it can be you can contract them, because typically people, not because they're sitting around contaminated, because again, the virus can't live on objects by itself, but when people are engaging in sex play and they're sharing sex toys. Also, accidental contamination when affected blood enters the body through mucus, membranes in the eyes, of the mouth, or cuts, abrasions, or punctures in the skin. And before 1985, it could be transmitted through contaminated blood transfusions or organ transplants, but now blood is tested and that doesn't happen. So as I mentioned earlier, half of the HIV/AIDS cases in the world are women, and women are actually are in a special, category when it comes to risk. And there are a lot of reasons for that. First, I want to clarify that the main reason that women contract HIV is through heterosexual contact or injection drug use. So those are the main 2 modes of transmission. As far as the risk factors, HIV infection is more prevalent among younger women compared to young men or older women, older men. There can be a lack of recognition of partner's risk. So some women may be unaware of their male partner's risk for HIV, such as unprotected sex with multiple partners, or sex with other males, or injection drug use. This sexual inequality in relationships also contributes to women's risk. Some women may not insist on using a condom out of fear that their partners will physically abuse or leave them. Younger women are more susceptible to this, and women are less likely to insist on using a condom. And then there's this biological vulnerability that's most alarming to me. A woman is twice as likely as a man to contract HIV during vaginal intercourse with a male. This is because there are large areas of mucous membranes in the vagina that create a very friendly environment for HIV. So all those mucous membranes within the vagina just consider just like an open door for sexually transmitted infections and HIV. It's not as easy for men to contract it from women as it is women to contract it from men. As far as substance abuse, an estimated 1 out of 5 new HIV diagnoses are related to either injection drug use or being under the influence of drugs or other drugs or alcohol, because that lowers inhibition and decreases the likelihood of using condoms. And then socioeconomic and societal factors, and people living with poverty or in poverty have limited access to quality health care and to education, so they often aren't aware of how it can be spread, how HIV can be spread, and what the preventative therapies are, what women's risk is when it comes to HIV, etc. Another vulnerable group in the United States is African Americans. In the United States, HIV/AIDS is considered an epidemic and a health crisis for African Americans. That's because African Americans make up 14% of the United States population, but half of the new HIV/AIDS cases, not only for 2008 but up to 2012, were for African Americans. And of the 500,000 people with AIDS in the U.S. that have died, 38% were African American. The primary modes of transmissions for African American males and females. For males, it is sexual contact with other men, followed by heterosexual contact and injection drug use. For African American women, it's heterosexual sexual contact, followed by injection drug use. And so, African American cannot talk tonight. African Americans are not the only ones that are at a high risk, but there are several factors that do put them at risk. And the issue is not race or ethnicity. I want to be very clear about that. Race, ethnicity is what we call a marker for other risk factors, such as poverty, access to healthcare. So more African American people live in poverty or low income, which limits access to quality healthcare. And then also when people have limited access to quality health care or they live in poverty, they're more likely to contract STDs or STIs. And that's due to the low levels of testing and treatment. And having an STI increases the likelihood of contracting HIV. Another issue is inadequate information or education about HIV. And also among the African American community, there's a lot of homophobia due to religion and religious beliefs, or even cultural beliefs. And also there's a distrust of healthcare professionals and the government in general. This distrust is well-founded when you look at how historically ethnic minority groups have been treated by the government and by researchers. You can look to the Tuskegee study, which exposed African American men to the syphilis virus on purpose, and then followed them without telling them that they had syphilis. They were told they had bad blood. They weren't treated even though treatment was available, so that the researchers could find out how it affected the participants in the study, even though they were unwilling and didn't know that they were in a study. And many men died as a result of this and passed it on to their partners or their children. So, this mistrust is actually very well-founded. Now, you may have heard that a lot of churches are actually taking, African American churches in particular, or churches within primarily African American population, religious leaders have stepped up and realized that they have to take a stand and help to educate people that attend their church about HIV, about the risks, how you contract HIV, and how to protect oneself, because it is something that has hit the African American community very hard, and everyone is starting to realize that we have a role in protecting each other and educating one another about this issue. Something you may or may not have heard of before is men on the Downlow. I know Oprah talked about it 10 years ago, maybe, when she was still on national television. Men on the Downlow refers to men having sex with other men, as well as women, but not identifying themselves as gay or bisexual. So they're on the Downlow or the DL, or even the low, because they're not disclosing to their female partners that they are engaging in sex with other men. The term has been used most often within the African American community, referring to African American men, most likely due to the homophobia and the religious and cultural issues we just discussed, but it has spread to other ethnic groups as well. So what's the issue here? Well, it's putting partners at risk when they have no idea that their male partner is engaging in intercourse with males. And so what's the issue with having sex with males? Well, oftentimes if condoms aren't used and anal sex is engaged in, there can be a lot of tears in the tissue, and that, similar to women, creates a nice environment for HIV to get in. And so that's why there is a risk among anyone that engages in anal sex. So not just men. But if a male partner doesn't disclose to his female partner that he's engaging in sex with males, then she has no idea to protect herself. So it's a serious problem, and we need to remove the stigma from the LGBTQ community. We also need to remove the stigma about HIV and educate all ethnic groups about this issue. You may or may not be aware that there's free HIV testing and counseling in Charleston. I've given you some information here about how to go about doing that. So it's free, it's anonymous, for anyone that's 12 and older. People under 12 or children under 12 need parental permission but can still get the testing. There's no eligibility restrictions, but appointments are necessary. And I've given you the phone numbers. That concludes my talk on HIV and AIDS.